TV studio for getting this up and going. It is 9:11 and I'll call the meeting to order. Open meeting requirements have been met. It was posted at 9:05 yesterday morning. Thank you to the clerk's office for getting that taken care of quickly. We have an agenda before you. Looking for a motion to approve the agenda.
So move.
Do we have a second?
This is Jeremy, I'll second.
Second by Jeremy.
This is Barb. If we're changing the order of the agenda, do we need to amend it?
Technically, no.
Okay.
But we can just agree to move it, but if we want to formalize it, we certainly can do that.
Okay, because Deb has requested number 6 move forward.
Okay. So, do you just want to amend that?
I make a motion to amend the agenda to move item number 6 up to the top of the agenda.
I'll second it.
Okay. Those in favor of amending the agenda to move number 6 forward, say aye. Aye.
Aye.
Opposed? Okay. Motion carries. So then, motion to approve the agenda as amended. All those in favor say aye.
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 Those opposed? Motion carries. So we adopted the agenda. You had minutes that were sent to you yesterday. If you've had a chance to review those, looking for a motion to approve the minutes.
Motion to approve.
I have a correction for it.
Okay.
It says I was there virtually, but I was not there. I was absent.
Okay.
This is Dustin.
Motion to approve with the correction.
Looking for a
I
second.
motion.
Okay, so we have a motion by Deb and a second by Barb to approve with your correction. All those in favor say aye. Aye.
Aye.
Those opposed? Okay, the motion carries. Public health, nope, we're going to move it up. Do you want to do this right away?
I appreciate you doing that. I have another meeting, statewide meeting I need to be at the same time. So I would like to talk a little bit, one of the things we said we were going to talk about at this meeting, and I'm at least get the conversation started, is about the American Rescue Plan Act funding. The discussion at our last meeting was that we would discuss it here, make some potential proposals or recommendations, and then forward that to the Exec Finance Committee. And they won't meet again for, well, a couple weeks anyway. So we have some time that we could work on this. I have provided to those in the room here, and I emailed to those of you who are virtual, a copy of the National Association of Counties summary or legislative analysis of the plan. And I also attached another document called Examples of how counties use CARES funding, and that came from the WCA, or maybe the NACO, I may be attributed to the wrong party, website. And this is, again, the examples were how CARES funding was used, that they have some different rules for CARES than they obviously do for the American Rescue Plan. The American Rescue Plan, as we said last time, we're still awaiting Treasury guidance. We still are in that situation, waiting for Treasury guidance. But in the meantime, there have been some conversations starting around the county because Trempealeau County is eligible to get $5.75 million. The first half will be sent to us. Once we spend that, we can request the second half. So I'm going to get on my soapbox a little bit, so bear with me. This is a once in probably a lifetime funding opportunity for our county, and I think we need to think seriously how we're going to use these funds to invest in our county, to address the basic needs of our county. I know that probably all department heads are thinking about how we can use it for our own departments. I would argue against probably a lot of that, including my own department. I think we want to think about how we could use these funds to, in fact, help all departments. Using it for additional highway funding, I would argue, is an investment in some ways, but there have been a lot of investments this county's made in highways, more so than in a lot of other departments. In terms of the new building, we can't really use it for that because you can't use it for funds that have already been budgeted, and since we've already bonded for that building, I would argue it doesn't make sense to use it for the new building. I would also say what probably a lot of people are thinking in this building, because I've heard it from people, is that some staff get a $40 million building and the rest of us get $3.5 million for finishes. And to put more money into the new building, I think is going to create a level of disparity between departments and tension between departments that's going to be unhealthy, so I don't think that's wise. So I would recommend that we think about how do we use these funds to make some significant improvements in our county overall. And I would also argue that this county, like many counties, is facing a human crisis. The jail is seeing it, the sheriff's office is seeing it, the health department is seeing it, we're seeing it, the courts are seeing it. I mean, it's affecting almost everything we do in this county. And how can we make a difference to start addressing some of the basic needs to help turn some of those concerns around? I mean, imagine if we could do something that would make a difference, that would reduce child abuse, domestic violence, mental health problems. Imagine the amount of workload that would change in so many departments in our county. And again, I'm not recommending we spend it in human services. I think we need to spend it on services for the people of this county to make those changes. Even significant changes like broadband, significant changes like helping municipalities with the wastewater treatment and having good water in our county. I mean, I live in La Crosse County and we've got French Island who doesn't even have good drinking water at this point. So I think that, again, if you think about the basic needs, whether it's the social emotional needs or just some of the basic health needs in this county, I would argue that we spend some time and maybe put some heads around it. I'm certainly not the expert at any of this, to think about how can we make some fundamental changes in our county that will make lasting differences for generations. So that's just my plea to you. I did, again, provide the materials to you that I think will help you think about how this funding could be used, has been used in other counties across the nation, and the guidance that's been provided so far. So that's, I'm sure there's lots of conversation and questions that want to happen around that.
Sorry to interrupt. Can you hear me now? This is the Sheriff.
We sure can.
All right. So I was hearing everything you were saying, Deb. I was trying to get my computer going. So just letting you all know I do have audio here now. I can hear you. Thanks.
I'm kind of wondering, what do other committee members think about how we can go about providing some type of recommendation to the Exec Finance Committee and therefore the county board? I do believe that there are conversations starting in this county already about how we could use this money, and I think we want to get ahead of it and think about how does this committee want the county to use it? What recommendations do we as a committee want to make? I've certainly shared my thoughts, but I'm only one member.
Any other discussion that anybody wants to?
I really don't have enough of an understanding of that funding and what it is or isn't for to really comment on it yet. I've listened to most of what Deb was saying there, but I didn't hear it all. So if you guys talk about the eligibility of what that's for, I didn't catch that part.
The only eligibility so far that's been printed out is you can't use it to fund pension plans and you can't use it for things that have already been budgeted, which is no surprise to us. We are still waiting Treasury guidance from the Department of Treasury. So until that comes out, I did send out a document to you and to all the other members in terms of what has been provided so far. It's an analysis provided by the National Association of Counties on what we could use it for, some examples. But again, there's those are just examples. I think we need to decide what do we need in Trempealeau County and how do we use these once-in-a-lifetime funds to make the best investment for the future.
I guess my thoughts are that you seem to have a really great understanding of this fund. I mean, when you brought it to my attention and everything, and I started looking into it, I thought that it wasn't at all what I thought it was. And so we do monthly reports. This committee does do a monthly report for the county board, and I intend to continue to do that. Perhaps at the April County Board meeting, if you would be willing to kind of explain what you know about this, because I don't think a lot of the county board members, including members of the Executive Finance Committee, actually understand what this money is and what it was designed for, but at least get ahead of, because we might have people, yes, trying to make decisions without the full picture of what's going on. But I certainly know, with what I do for a living and what I experience personally within my family, that the pandemic created a tremendous mental health crisis for people in our county, and it, as we all know, mental health, undiagnosed or untreated mental health conditions spread all the way out across all our departments, and we all end up having to help people deal with that, whether they're the person that is experiencing the crisis or people that are in their immediate circle, or the people serving them. So if you wouldn't mind doing that for the April meeting.
Sure, I'd be happy to. I also do want to mention that in this funding, there is special money set aside for vaccine distribution, separate from what the county gets. There is funding for Medicaid. Of course, that's a debate in the state of Wisconsin that I'm not going to get into. There's funding for testing and public health resources. There is some funding that they're going to increase some substance abuse and prevention grants to the states. How that gets sent out to us, I'm not certain of. There's some funding for some nursing home strike teams to help them establish teams to respond to outbreaks in facilities. There's funding for some direct funding for families. Again, how that is distributed from the feds to the state to the county, I'm not clear on yet. There is some housing and utility assistance. There is some homeowners assistance funds. There's rural housing funds. I think some of the housing needs will be addressed through lending facilities and other facilities that work in housing to help some of our local individuals. How far and wide that goes, I'm not certain at this point. There is some additional funding that, again, could come to the food share, depending on what the state of Wisconsin chooses to do regarding Medicaid could affect that. There's some additional funding for unemployment that I'm sure you've heard about in the news. And then there's some aging funding, which will go to help support some home-delivered meal programs. And we did get some last time with that. I will say that I think the senior nutrition program is in a pretty healthy place right now, and that would not be one of the top things on my list. This county has made some really appropriate investments in senior nutrition, and we are probably at the end of 2020 going to have probably about $200,000 set aside for future funding shortfalls, so to avoid that cliff effect. So I think that program is probably in pretty good shape. I think there's a lot of other needs in this county that are not in as good a shape.
Okay. Any other questions or discussion on that? Okay. Moving on. So then this is public health update. Barb?
Okay, excuse me, right now, our 7-day rolling average is 9.2, which puts us in the yellow area. We have new cases, it looks like 3 so far today. Our total cases was 3,503. What we've got active right now is 34. We've got 3 hospitalized. Total hospitalizations is 117. We've got 3,430 people recovered. We have 39 deaths. We are seeing an increase in COVID cases over what we were last month at this time. In our meeting with our partners at Gunderson Tri-County, they noted that the Twin Cities is seeing a jump in their cases, and that they and Eau Claire are doing some assisting of the cities with ambulance rides. I believe that Eau Claire hospitals are also seeing an increase in inpatients um, coming from the cities. Just an update on what's going on around us. We are currently doing a National Guard testing out at the Annex in Independence. We are working on every Wednesday doing vaccines here. We continue to partner with Gunderson Tri-County and Mayo in terms of trying to get immunizations out to everybody we can. Let's see here. We are starting to see a lag in our abilities to fill up our appointments. And the other counties around us, in terms of the health officer meeting, it says they're starting to see the same thing. We are planning an outreach to the Hispanic community to see if we can get more of them registered for shots. We received our first of the Johnson vaccines this week. So we just did distribute some on Wednesday, along with the Pfizer, which we have been receiving since the beginning. We know we're getting some Johnson next week, but it is unknown at this point how much Pfizer we will get. I don't think I have anything else.
Anybody have any questions for Barb?
With the increase in cases, do you have any recommendations for this committee in terms of anything we should be or could be doing in terms of county operations? I mean, we're continuing the mask requirements for this building in spite of the state decision. Is there anything else we should be preparing for?
At this point, it's hard to tell, but I definitely think we should be encouraging us to still wear masks in the building, having our staff wear masks when they're out, not only setting a good example as well as protecting themselves. Otherwise, I think when it comes to things like, I know some of the conferences and stuff are starting to open up. I think that it's up to each department head's judgment as to the value of it. A lot of times you're behind the eight ball if you don't go.
I see on the Personnel Bargaining Committee agenda that the discussion about the remote work is coming up. The policy has been approved for remote work through the end of June. Does this committee, based on Barb's report, have any recommendations that we continue that for COVID or any recommendations?
I would recommend it, that we continue it.
As well as the leave, I assume.
Yes. We're not out of this yet. COVID is not gone. It's just changing its nature.
And do we know of the new cases? Do they include any of these new variants that are coming through? Is that what we're seeing is maybe the new variants that are spread more easily? Or you don't know?
Not all of the cases are analyzed for what its genomes are, but yes, we have seen one of the variants in our county.
Thank you.
Barb, in a recent meeting that I've been in with you, you mentioned that there had been an outbreak up at Whitehall School District at the high school. What did the final numbers end up being on that? Are we still getting numbers on that one?
I haven't seen the latest numbers. The original numbers were like 6.
Okay. And then they went on break.
Yep.
Okay.
I have to excuse myself for a second because I have to answer our door. I'll be right back.
Okay.
Well, I'll weigh in on the question at hand here is, I don't have an issue extending the COVID leave. I'll withhold comment on the at-home policy because I really don't have any working at home right now. And if I do, it's only 1 or 2. That hasn't happened in many months.
I think, I mean, let me just check this, but, okay, down to number 8, we can address that. It is listed as a discussion or action on, so, let's bring it up at that.
Yeah, I won't be there for that part, but I certainly
okay.
would support that.
I'm back.
Okay. If that's on the public health update, then let's move on to number 6, discussion relating to COVID grants available through the routes to recovery and other sources. We already kind of covered that. Is there anything else that we need to know about?
The only other thing I'll say is that in addition to the 5.75 million, we still can get FEMA funding through September at 100%. So if there are operational things in this building, or for our staff, or for not even this building, but even the highway, however, anything we need to adapt or change or do differently because of the pandemic now or long-term is still available for funding. And so if people have ideas of things that they would like to do or need to do or want to get, please contact myself or Paul. We would love to talk to you, and we will connect and see with the Integrity Group, because they really are the experts at telling us to make sure that it's something we can get or what kind of documentation we need to provide to make sure it can be funded. But we, in addition to the 575, we still have FEMA funding. There is not a cap on that. So it's 100% reimbursed. So this is still a great opportunity for our county to be thinking out of the box in terms of if this pandemic were to explode again, or if there's another type of pandemic, what things do we wish we had, could get in order to be able to serve the public effectively in spite of a pandemic.
Okay, any other questions or discussions on that?
I was just briefly reading through the document that Deb had sent by email. It mentions in there that local municipalities also have so much in billing set aside. Do you know of any towns, cities, or villages in our county that have?
I don't have that information. That's a great question. I don't have that yet. I'll be doing some research through WCA and see if I can get that. It would be helpful to know what everybody in Trempealeau County has as we think about big pictures and big investments. I think that that's a great question.
Any other questions or discussion? Okay, discussion and action on availability of PPE. Jeremy?
Same as the last meeting, I've given out a handful of gloves here and there, but I still have a decent stockpile of gloves and sanitizers, wipes, cleaners. So like bringing it to the departments as they ask for it and keeping a fairly decent stock on hand. But other than that, the courthouse's supplies are just fine.
Okay, any questions for Jeremy? Okay, moving on, number 8. Discussion or possible action on new or existing COVID-related county policies. The virus outbreak pandemic response plan. I think the IT department is going to be submitting theirs, I believe, to their committee for review. So we've got one committee one department that has been working on theirs, so there's some good news there. Anybody else have information, questions? Okay. B, precautions, preventive measures for county facilities staff. We just talked about discussion about continuing the policies of encouraging they continue work from home policy, or also the Leave Act. Is this something we should put on the agenda for more discussion at the next meeting? Or does somebody want to make a motion now on it?
I would motion that we continue those until the end of the year.
Do we have a second?
I'll second it.
Okay. Was that you, Brett? Or was that Jeremy?
Yes.
It was Brett. Okay.
Sure. Sorry about that.
Okay,
It takes me a minute to find the mute button, so I silence is because I can't find the button.
That's okay. Yes, that was the motion to continue until the end of the year for the leave. And does that also include the work from home policy?
Yes.
Yes, so both, work from home and leave. And then to make that recommendation to Personnel Bargaining Committee. Okay. Any discussion? Okay, all those in favor say aye. Aye.
Aye.
Aye.
Aye.
All those opposed? Okay, the motion carries. Other COVID-related topics for future meetings? Just kind of keep the same agenda going forward?
Works for me.
Okay.
Yes, I would say so.
Yeah, I think in a pandemic, the situation is always fluid, so keep what we know works and add as we need to. I don't know of any reason that we need to go into closed session, and our attorney's not here to tell us whether we can anyway, so. I do not know of any reason to go into closed session, so. So, our next meeting is April 23rd, because Sam's on this now. April 23rd at 9 a.m. Does this work for everybody?
Yes. Oh, what was the date again?
April 23rd. Okay, hearing,
Yeah, we're good.
okay, then we're going to go ahead and have our meeting April 23rd.
Good,
9
here.
Okay, sounds good, guys. All right, I'm going to go ahead and adjourn the meeting, and thank you, everybody, for your patience with all of us having various technical difficulties.
Bye, everybody.
Have a good weekend.
You too, everybody.